Hey everyone, welcome back to Rehab and Revive Physical Therapy. Today we're continuing our taping series with taping of shoulders for posture. So if you struggled with forward shoulder, I'm sure you've seen those devices that help you to hold your shoulders back like this, but oftentimes this is unnatural, doesn't have the proper muscle activation, and a lot of times people end up with pain being back there when they're not ready. So how do you feel about editing? Does it? Do you feel like your shoulders come forward?
Yeah. When I'm editing, I find myself like really hunched over, and I have to remember to straighten up my shoulders again.
Right. So I think a lot of times with people who work in front of a computer, they want to have good shoulder posture, but it's hard to remember to not allow your shoulders to roll forward, and that's sort of what they naturally want to do. So this taping is a really good way to not necessarily keep your shoulders pulled back, but actually give you your muscles a little cue to activate and hold your own shoulders back. So let's get to it. Before we start taping, we have to identify a couple of landmarks that we're going to tape. So the first is the coracoid process, and that's right here. Ding. We also have to identify where the shoulder blade is. Now, the shoulder blade is in general right here, and we can see some of the landmarks here if we palpate. So you can see the bone, the inferior angle here, superior angle, and it's sort of a triangular shape like this. So we don't have to worry about where it is too much, but we want the tape to come over it like this, and it's going to be an X like this. So from the coracoid process on this side, going to be an X like that. Okay, so let's first prepare our coverall, and today we're using coverall and Leukotape. Step 1, we're going to measure out the length of coverall from the coracoid process in the front here. And then I wanted to extend at least down to sort of the border of the latissimus here. And I want to make sure that the tapes do crisscross. So that's about a good length. Okay, and then I'm going to cut an identical. So I got my piece here, so I'm going to cut an identical one the same length. Okay, now I've got my two coveralls here. So before we start, I want to make sure that his shoulders are in good posture. So 3 simple steps to put your shoulders in good posture. You're going to shrug your shoulders up, turn your palms out, and then relax. That's it. No need to pull them back a lot. Squeeze. Go ahead and squeeze back here. No need to do this. This is too much. No one can sit in this posture for very long. So, yeah, and it's not comfortable. Yep, perfect. Just like that. That's all you need to do. And then we will give you a little bit more of a pull when we do the layer of Leukotape. But for now, this is good. So from the coracoid process right here, and we are going to go across like that. Good. So I'm making sure that I'm under the shoulder blade here. I'm not really going over it. This is the border of it, so right under there. And then we're going from this coracoid process, which is right here, and coming across like this so that it's pretty symmetrical. Okay. Good. All right. So now let's do the Leukotape. So Leukotape, like we use in a lot of our videos, very sticky, very strong, does not stretch. So you don't want to get it directly on the skin, which is why we use the coverall. Okay, now I'm going to have you set your shoulders again. So shrug up, palms out, and down. Good. And then I want a little bit of a squeeze here. Not much. That's it. Yep, just a tiny bit. I don't want your shoulders to be pulled too far back. That's going to be uncomfortable and can even cause a little bit of pain. So just a little bit squeezed there. All right, so I'll make sure the tape is down properly. Sticky there, sticky there. You can rub it. The heat increases the adhesion here. There's one, and then let's do the other one. All right, very good. Okay, so Griffin, go ahead and relax your shoulders. All right, so you see as you relax your shoulders, how do you feel?
Like it's pulling on it, like a little constricted.
Okay, so it kind of makes you want to go back into that position, right?
Yeah.
And now it feels like it's not pulling.
Mm-hmm.
It's good.
Yeah.
So Griffin's actually using his own muscles here to keep himself in good posture because of the tape. It's just a nice reminder. It's a little cue, and it's not going to stretch. Okay. All right, Griffin. How does it feel?
It feels really good. When I want to go down like this, it kind of reminds me just to go up, but it doesn't feel like it's holding me, so I can tell my muscles are doing it. So
right,
nice.
And that's sort of the point of the tape. It shouldn't really be holding you back necessarily. It's a little cue to help you to bring your own shoulders back and have your postural muscles work. So you can wear this tape up to 3 days. If it starts to irritate your skin, become red, painful at all, that means you're having an adverse reaction to the adhesive in the tape. Go ahead and take it off. Use a little bit of warm water. Also, you don't want to become dependent on using tape. You want to use your own muscles. Do some postural exercises. That's really what's going to help you fix your posture. Practice a little bit each day. 5 minutes here, 5 minutes there. Your body's going to become used to having good posture, and yeah, that's sort of the secret. Thanks for watching this video. If you liked the video, leave us a like below, subscribe to our channel, follow us along as we continue our taping series. Let us know what your favorite tape is in the comments below. We're here at Rehab Physical Therapy. I'm Dr. Luo. This is Griffin, and we'll see you in the next video.